Imagine you wake up and you are covered in bruises and tiny red spots. You think to yourself, did I fight someone in my sleep? No, you didn't. It was just your immune system being a drama queen. And she decided to kill all your platelets. Hi, my name is Charlotte, and this is my friend Patty the Platelet. And she's going to help me talk about immune thrombocytopenia purpura, or ITP. As parents of children with ITP, we face daily challenges every day, but we can manage this condition and help them have a better quality of life. What is ITP? What is ITP? According to Mayo Clinic, ITP is an illness that causes bruising and bleeding. And one of the first signs of ITP is petechia. That's a hard word to say. It's petechia. Petechia was my first sign that something was wrong with my daughter Natalie. At first I thought it was just a rash, but then the more I looked at it, the more I thought I need to take her to the doctor. Since seeing our spots, our daily lives have been different. Now you say, Charlotte, how has your daily life changed? Well, bruising is something we see every day. Used to, when she would get a bruise, I would think she hurt herself playing. But now, we do daily checks for bruising and new petechia. I personally know when Natalie has petechia, her levels are less than 20,000. We have had nights where we had to stop what we were doing and take pictures and send it to her hematologist to see if we need immediate labs. Daily life with ITP means living in a constant state of worry and always being on alert. We keep her physical activity limited, which means no riding a bike, no jumping on trampoline, and no running. Because if her levels are low, the slightest bump can cause internal bleeding, and that can be dangerous. Going to school and playing has also been different. I have to talk to her teachers and her friends' parents to show them what petechia is and what to do if she has any amount of bleeding. One morning, out of nowhere, Natalie lost a tooth. She bled for like 5 minutes. She goes to school, and she's there maybe 3 hours. Teacher calls and says she's bleeding, and they got it to stop, but Natalie couldn't focus on her work because she was scared that it was going to bleed. So, just like losing a tooth, ITP shows up out of nowhere. Boston's Children's Hospital says Boston's Children's Hospital says ITP is an illness that causes bruising and bleeding, and it occurs after a viral illness, such as the flu, the common cold, and coronavirus. Okay, now. Those are just some examples. I learned that the symptoms of ITP can show up 4 to 8 weeks later, after being sick. The easy part is knowing what causes ITP. The hardest is how to treat it. Most get better on their own, but many children need treatment. Treatment consists of steroids, IVIG treatments, or in severe cases, a splenectomy. Doctors also monitor your platelet count. Natalie has weekly labs done because her levels are so dangerous. I wish I would have known that her labs will be up and down, because I personally get excited to see a higher number, and then I'm disappointed when the numbers drop back down. Some children may still have a lower plate. Some children may have low platelet count even after treatment. Natalie has taken a steroid and it was fine, it worked, but now her levels are down and we are planning on doing the IVIG treatment. There is no cure for immune thrombocytopenia purpura. For those that have consistently low numbers for over a year, it is considered chronic. Risk of spontaneous bleeding can occur at levels less than 10,000. If you hit your head or stomach, it is considered a medical emergency because you can bleed internally, which is life-threatening. Are you curious as why we make such a fuss over platelets? Platelets help your blood clot. If you don't have enough platelets, then it takes you longer to stop bleeding. Just to paint the picture a little bit better, let's look at my chart. Wikipedia says normal platelets are between 150,000 and 430,000. ITP is a rare autoimmune disease, and Natalie's platelets are at 14,000. Cleveland Clinic says about 4 out of 100,000 children are diagnosed with this condition. Marchadime says that in 2023, there were 2.8 million children diagnosed, there were 2.8 million children in the state of Georgia. So if you put that in perspective of 4 out of 100,000 and we have 2.8 million in Georgia, that equates to 112 diagnoses a year. So now that you know immune thrombocytopenia purpura is just your immune system being dramatic, now you know how to treat it and manage it. And you just think it's overreacting. Thank you for having myself and Patty the Platelet here today. And I hope you just learned how to manage ITP and how to make your children have a better quality of life.